Start the meeting. So just to inform everybody present that this meeting will be recorded in Microsoft Teams and then will be uploaded and available for repeat viewing on the council's website. Councillors, officers and partners attending will be asked to introduce themselves before they speak at the meeting for the benefit of any members of the public who may be listening. Just to help me with the meeting, if any members of the board wish to speak during the meeting, please can you indicate your wish to speak in the chat section of the screen and then wait to be called. And when not speaking, please can you put your microphones on mute and switch off cameras. I don't think we have to do that, do we? But there we go. And when called to speak, please switch on your camera and unmute your microphone and pause for about 3 seconds for a slight time delay in connection. And if you're addressing the meeting, please can you have your camera on when speaking. Okay, thank you. So we'll move on to the agenda.
Ruth, just to let you know, you're breaking up a bit every now and then, just so that you know.
Okay.
I don't know whether you're aware of that.
No, I'm not.
Yeah.
No. I'm at work today, and somebody has just been to see me and said that there's an issue with internet connection. So I'm hoping this is all. If need be, I'll switch over to my iPad. But so far, it looks okay for me. So let me know. Send me a message or a text if I'm cutting out.
Okay.
Okay. So thank you for coming along on a Friday afternoon, everybody. And so if we start the agenda, first item is declarations of interest. Nope. And then so agenda item 2, which is the Buckingham, Oxfordshire and Berkshire West Integrated Care System and the Joint Forward Plan. And it's going to be presented by Rob.
Afternoon, everybody.
Hello.
So my name is Robert Bowen. I am the Acting Director of Strategy and Partnerships for the Buckinghamshire, Oxfordshire and Berkshire West Integrated Care Board. And as we've said, the purpose of today is for me to provide an update on where we are with the Joint Forward Plan, but really it's for an opportunity for us to have a conversation specifically about alignment between the Joint Forward Plan and the published Joint Health and Wellbeing Strategy for Berkshire West. So what I'll do is that I'll pretty quickly just say a little bit about the Joint Forward Plan, what it is, the process that we've been through to get here, and then I'll explain how we've tried to make sure that there is really close alignment between what we're publishing for the Joint Forward Plan and what exists in the published Health and Wellbeing Strategy, if that sounds okay. So I'm going to start by taking us back a step, start by going back to the Integrated Care Strategy, which was developed and published on behalf of all of the partners across the BOB integrated care system. And that is a document that built on the priorities and ambitions that were published in the existing health and wellbeing strategies that were that had been developed by each of the relevant local authorities across the Buckinghamshire, Oxfordshire and Berkshire West geography. Through the development of the integrated care strategy process, we really deliberately tried to make sure that we were reflecting and building on some of the ambitions that had been published through the local strategies. So there is very close alignment that has already been recognised through the publication of the integrated care strategy between the sort of system-wide strategy and then what we've got in the different local authority areas and across Berkshire West. The Joint Forward Plan is really an NHS Joint Forward Plan. It's about the NHS setting out its ambition for how it will deliver both the ambitions of the integrated care strategy and also some of the ambitions and commitments that the NHS has to meet the needs of the population that we have across the BOB system. So as we look into the Joint Forward Plan and some of the information that we've included in the Joint Forward Plan, we need to be aware that this is the this is an NHS plan, and although it describes some of the NHS services, we've also tried to make clear the ambition that we've got to really continue to work in partnership, both across the system, but also locally in the Berkshire West environment. That ambition to work in partnership with our local authorities to make sure that we are collectively and together meeting the health and wellbeing needs of our local population. As we have developed the joint forward plan, we've done that through a process that has started with looking at some of the services that we provide across the whole of the system and using our system-wide networks to make sure that we are reflecting some of the collective ambitions that we've got for those clinical services. And then going through a process of engagement. So we published a version of the joint forward plan at the end of March. And from the end of March, really up until now, we've been going through a process of engagement where we've been coming out and talking to local authorities, health and wellbeing boards, our NHS partners, and also a period where this has been open to the general public, and we've had some focus groups that have again allowed us to build and reflect some of the local ambitions for our services. We've had a period where we've been able to take some of those comments on board and build build more detail into some of the ambitions that we've got. We've now got to the point where we've got a published strategy, and what we've circulated with the papers for today are two things. One is the summary document for the joint forward plan, which is it's a sort of PowerPoint based summary, but it's reflecting lots of detail that's available that sets out really some of the specific ambitions that we've got for delivering the integrated care strategy, and the structure that we've used in the full document, which is about 180 pages long. It sets out real detail for those service plans, but using a structure that very deliberately aligns to the structure of the integrated care strategy. The other thing that we have published is a summary paper, and that summary paper sets out as explicitly as we can how we think that there is alignment between the joint forward plan and the published Berkshire West joint health and wellbeing strategy. And if I might just talk through the table that's in that paper, just to make clear that we have taken some of those local ambitions and structure into account. So the 5 priorities, and that we've set that out according to the 5 priorities in the health and wellbeing strategy. So the first around reducing differences between people. We have a theme that's run all the way through the integrated care strategy and all the way through the NHS joint forward plan, that really sets an ambition to do more collectively with our partners to target inequalities. We've flagged that as one of our 4 main challenges that we want to work together as a system to address. But we also have some quite specific ambitions that have been set out in a number of our clinical areas where we have some quite specific measurable objectives around tackling and addressing inequalities and providing support to specific people and communities across the Bob area. The second is about supporting individuals who are at high risk of poor health. And again, prevention is something that has been a core sort of golden thread that's run through the integrated care strategy and into the joint forward plan. And prevention, we'll see in the detailed version of the plan, is something that is very, very strong, that flows all the way through each one of our service delivery plans. But we've got specific, one of those service deliveries plans is specifically about our prevention capabilities and how we propose to build some of that prevention capability, working very closely in partnership with each of the local authority teams that we have our partnerships with. The third area is around supporting families and children in their early years development. In the integrated care strategy, we have a particular some objectives specifically focused on Start Well, and similarly, we've taken forward those objectives into some of the service delivery plans that we've articulated for children and young people, particularly looking at some of those objectives that are in the integrated care strategy, but noting a commitment there that there is more that we'll need to do to develop some of the specific plans around how we will work with local authorities around early years development. Priorities 4 and 5 are really focused on mental health, both in children and in adults. And as we've set out in the strategy and subsequently in the joint forward plan, there are some very specific objectives that we've got about how we aim to support children, families, and people at other stages in life who are struggling with mental ill health, but how we would like to move to a more preventative way of trying to support those people who are at high risk of poor mental health. So that for us is how we've tried to set out the alignment between the joint health and wellbeing strategy and the joint forward plan. I'm really happy to take questions on how we've developed it, how that has iterated through the engagement that we've had, or any specific questions about that alignment. So I think open for questions. Just while we wait for questions, there is a specific outcome that we're asking for from this conversation, and I think it's helpful to be explicit about that up front. And that is the request that's in the covering paper in point 2.8. And each health and wellbeing board across the Bob area is being asked to provide an opinion that will be published with the joint forward plan on whether or not the joint forward plan takes proper account of the joint health and wellbeing strategy published by that health and wellbeing board. So there is a sort of specific response that we're looking for. And John, I don't know if Martin and colleagues have been able to pull together a draft. I know that there was consideration of that, but that is a particular outcome that we'll be looking for the health and wellbeing board to respond to.
Would you like me to respond to that?
Sorry.
I see Jason's got his hand up.
Yeah, should we just thank you, Robert. Should we go to Councillor Brock first? If I did you have a question?
Yeah, thank you, Ruth, Chair. Look, so I took the time to read some of the other responses that other health and wellbeing boards had produced. So, and thank you to Nikki for collating those. Oxfordshire's was quite underwhelming, so we'll ignore that. But Wokingham's and West Berkshire's were, I think, quite useful in a few ways. I mean, firstly, because they still manifested a bit to me a kind of you attitude, like, you know, you haven't done this and you haven't. They weren't especially critical, but they nonetheless still didn't embrace the kind of the approach of trying to be genuine partners within the system, which is, I think, the whole point of producing a joint plan. So I'll try to avoid that kind of approach, and I think it's important that in our formal response, which I'm sure John and Martin will draft up, that we avoid that as well. You know, don't go into it with the wrong sort of approach and philosophy, because we're not going to get much out of the exercise if we do. What was interesting, I think, was an acknowledgement within the Wokingham and the West Berks ones, more so in the West Berkshire one, acknowledging that place is a legitimate level on which to discuss some of these things, rather than being excessively local authority focused. And I would return to that point, Chair, that we have to think as a health and wellbeing board how we better collaborate with our two neighbouring authorities in Berkshire West to have a sort of coherent overview of how some of that place-based working is going on, because otherwise it's asking a bit too much of colleagues like Sarah to sort of come to free boards and always kind of talk and talk about place, but not really, because they're trying to talk about the local authority level. And we need to acknowledge that, you know, if you live in Lower Early, you think you live in Reading, right? You don't care whether something's delivered one side of the local authority boundary or the other. All you care about is whether you can access it. So we'll have to get to grips with that. My one sort of thing that I think is perhaps not as fleshed out in the sort of plan as it could be is how we will engage as a system with those wider determinants of health. I think that is probably not there in the way I would hope it would be, especially around housing, but also around some other partnerships and schools in particular. I feel that the sort of start well section is a little bit more superficial than some of the rest of the plan. It's not that I think it says the wrong things at all. I just haven't got as clear a sense of where we're seeking to go around start well as opposed to live well. I like that age well is very short, and I think that's right and appropriate, because actually I think it's a much simpler area to deliver, and I think in a plan you don't need to be overly complex with it. I'm surprised that no one seems to have picked up that there's kind of in 3.4 there's only one service area mentioned, but nobody seems to have picked that up. So I'm just going to assume everybody agrees with me all over the entire system, and they think that age well should be reduced to a single point like that, and it's beautiful. But if there is some expansion to be done there, I think that we as councils across the whole system need to be really driving that forward, and that's the role for Melissa. So we can't, again, take that you approach. You know, you haven't said enough about this. As councils delivering adult social care services, we should be saying, well, actually, we think we haven't reflected enough of what we want to aspire to do in the plan as currently is. So they're my sort of comments, which I hope make sense. But I'm really happy if others wanted to challenge back on any of that as well. Thank you, Chair.
Thank you. John, did you have a?
Yeah, so, well, yeah, Rob asked me what I thought. And I think Jason's points are well made. You know, I'm coming to this late in the day. I'm interim. I'm here for a few months. What I'm hope to try and do is facilitate some of the joining up that needs to be done and help to get public health back on track. My take on this, and you know, this is a familiar story. I mean, in the last couple of years, I've worked in Sussex and in Northamptonshire. Worked in Scotland, which has got a different set of arrangements, but they're trying to do integration. And now here. You know, not to put too fine a point on it, the problem is that we tend to look from the wrong end of the telescope. Now, you know, I was asked about my response. I share the kind of reservations that Wokingham and West have, but I don't think it's particularly helpful for them to get in the way of us starting work now. I think what needs to happen is we need to see that we're embarking on a journey, and I would be, you know, I'm always impatient to look from the other end of the telescope and to build strategies from the bottom up, which is very much about building them up from neighbourhoods and places and primary prevention. And but I would hope that over the next year or two or three, that's where we can get to. You know, if I use a couple of illustrations of why it is the wrong end of the telescope. In 1967, David Steele's Abortion Act allowed for women to have a termination of pregnancy essentially on social grounds. It was 7 more years before we started providing contraception in general practice. So we provided an abortion service, but we didn't provide contraception for women to prevent the need for abortion. And that's the way the NHS tends to operate. It tends to respond downstream to issues, and then in responding downstream, becoming gradually aware of what needs to be done upstream to do something about it. Now, when I say I'm ambitious, I would like to reduce general practice consultations by more than 20%, as they have done in parts of Finland, by systematically educating the general public in how to manage common conditions for themselves. We'd not attempted to do that in this country. I would like people who've got dementia to be able to stay independent living in their own homes, in their own neighborhoods, for an extra 1 or 2 years. That's totally possible if we have the right kind of investment in the right kind of housing, in the right kind of places, building neighborhoods with the local authority housing department and the local authority planning department working hand in glove with the NHS investment decisions into primary and health and social care. But we're not doing that at the moment. So we're trying to work backwards from hospitals, doctors, nurses and beds into prevention, instead of working forwards from keeping the population fit and resilient in their own neighbourhoods and communities and homes, and then seeing what's the health service needed to support that system. So we're asking the wrong question in the wrong way. But that's what we've always done. What I would hope is that we can now begin a conversation about how we turn it on its head over the next year, 2, 3 years.
Thank you, John. Robert, did you want to sort of come back, or should we go to other speakers first? Because I think Sarah was.
I'm really happy to sort of collate a series of comments and then sort of respond. So if Sarah and Rachel want to come in
brilliant.
first,
Thank
I'll
you,
respond.
Sarah. Then, if you wanted to come in.
Thank you, Chair. I think I just wanted to reiterate a couple of Rob's points around the plan is a reflection of where we are now. We've written it in relatively early days of our partnership forming. And so inevitably within that, some of it is a bit of a plan for a plan. We know we want to tackle some of those ambitions that John has just mentioned. At this stage, we're not crystal clear on how we're going to do that, but we know it's something we need to work on so that we can have that answer. And so in future iterations of the plan, we'll see more maturity and a more strategic approach to some of those things around prevention and really shifting the dial on what we're doing and how we're investing our resources to make that happen. So I just wanted to reiterate that commitment is there. And it's a plan that's revised and refreshed, as all good plans should be. It's not set in stone. We keep reviewing it, and it should be agile. And it's something we'll be doing together in partnership. And as our place partnership matures, as Jason's referred to here in Berkshire West, again, we'll be able to reflect a greater kind of representation of our local needs in this joint forward plan. So this is what we're doing in this particular ward here, because that's what's going to make a big difference in this area here, or for this community that we know we need to do X, Y, Z for. So I think going forward, we will see that coming through in the plan, and really pleased to hear comments around thinking this is the right starting point and wanting to work together to develop it further. And sorry, I should have introduced myself. I'm Sarah, Director for Berkshire West for the ICB.
Thank you, Sarah. I think Rachel wanted to speak
I'm
next.
gonna have a go, but can you hear me?
Yes.
You can. Okay.
Yeah, it's quite quiet, but we can hear you.
I'll be shouting, but I'm not cross. So, well, I'm not no more than usual. Kind of building on from that, then. It's really great to see the challenging health inequalities, prevention focus. But for me, a bit like John, I went straight to the kind of delivery plans to actually see how that's being translated into the actual ambition on delivery. And it's a bit mixed, and I think it's lost a little bit when it actually comes. And there's some really good examples in there. So I'm going to focus on the really good example, which is around maternity. where they're talking about co-production, they're talking about taking services to people, holistic services, they're talking about language, they're talking about culture. So they've really reflected that ambition in their delivery plan. And others, they think of access as being able to, the GP answering the phone has been the sort of translation of that, which is not what it's kind of about. There's an element of that. But so connected to that, then I was looking at, okay, well, where are those delivery plans accountable to? And there's just a tiny little box, so I understand that you can't put too much information, have a huge number of abbreviations, so I'm really none the wiser on where those delivery plans will go to. And I'm just thinking about how we communicate this to, from my perspective, the rest of the voluntary sector and all its diversity and understanding, but also the wider community, and whether we need to add on something or make some reflection around communication, engagement, making it really transparent for people how this is working and how it's being held to account. I know it's already nearly 200 pages, so I can understand the abbreviations. Certainly needs a glossary.
Thank you, Sarah. And Jason wanted to come back.
Yeah, so thank you, Ruth, because John opened up a sort of window to talking about my favourite legislation or whatever. Let's talk about it. So I philosophically, I think it's quite interesting because, so my favourite piece of legislation, the Children Act 1948, because for the first time, it treats children as having social needs, common needs, but also individual needs, rather than just treating children as this sort of abstract group of people that will one day be adults, and until they're adults, they're not really legitimate for thinking about in terms of their individualized and socialized needs, right? And I feel like we're kind of at that sort of tipping point in terms of some of this, because when we talk about the population of the Bob area, it is this quite indistinct mass. And so it's only when we start drilling down to what should and must happen at the place-based level that we're really going to get to understand the individualized and the socialized needs of our residents. And that's again why I think it's important that we start to orient our thinking towards place, acknowledging that there are differences within place. Obviously, within Berkshire West, some of the challenges in Reading are going to be different to the challenges in West Berkshire and in Wokingham. But obviously in Oxfordshire, the challenges in Henley or in Sonning Common are going to be different to the challenges in Banbury or in Blackbird Leys in Oxford. You know, there's no difference. And so this idea that there's something wrong with place and place-based partnerships just because they don't map against local authority boundaries is a fairly absurd thing. So I guess I say it, and thinking about the Children's Act 1948, as I do every day, is just a sort of window through which I think in our response, Chair, in your response, I'd like to really emphasise that point about local authorities having to do their part in terms of making the partnership work by reorienting some of our thinking towards place, and how can we best do that? And that doesn't mean any loss of sovereignty for councils. It doesn't mean that we won't still be delivering adult social care and children's services that deliver for Reading's population. But how do we make sure we're engaging as we best can at the place-based level to make sure that things are working for our residents? And I know that other partners, VCS, but also private sector partners are going to have to go on that journey as well. But the best way we can do, if we're going to encourage people to do that, well, we have to do it ourselves, don't we? So I think we need to be the leaders in doing that in Reading, because nobody else is going to lead on doing it in Berkshire West.
Thank you, Jason. Right, I'm just checking who is next, and I think Sarah.
Thank you, Chair. Just to come back in as well on Rachel's point around who's accountable and who's accountable for making sure this is delivered. And I think it's really important in our response to the Health and Wellbeing Board that we acknowledge our role in this as well as a board. Sort of, we are a collective of subject matter experts and local experts who know our residents, know our population. And so we will have a view on the outcomes that we want to see improved and the areas that we want to see invested in. And so strengthening our role as a health and wellbeing board in making sure that as a collective of partners, we're delivering against that, whether it's something that can only be delivered by coming together at place, whether it's something that we should be doing here uniquely to Reading, or something that actually can only be delivered if we come together across all of Bob. That's how I see kind of the role of us in this board going forwards as well. And so I think perhaps in our response, if we're quite clear that that's how we want to play our part in this and how we want to help make sure it's delivering on behalf of our residents, I think that's probably quite helpful as well, would be sort of my reflection on how we might want to address that point in our response. And I say that as a member of the Health and Wellbeing Board with that hat on right now, I suppose, as opposed to my ICB hat on, although I'm constantly shifting them on and off my head.
Thank you. Thanks, Sarah. I think it's over to you then, Robert, unless anybody else wanted to raise anything. No?
Let me go, and if other people want to come back, that's absolutely fine. I only wish I could keep up with Jason starting my reply with my favourite bit of legislation is ... but sadly I can't. Thank you everybody for comments. It's really helpful to hear different ambitions and reflections on what we've published. If I might just come back on a few of them, but I think I'm largely in agreement with comments that have been made. So firstly, starting with a principle that Sarah mentioned that I hadn't mentioned, we've set out here a 5-year plan. The ambition is that this will be annually reviewed. So this essentially is the first of a rolling 5-year plan that will be published annually. But that means that as we think about some of the areas where we think there is more that we could do in partnership, either at place level or perhaps wider, we've got opportunity to build that into subsequent iterations. And so therefore, reflecting on a few of the comments that have come through, yes, I agree. At the moment, in this iteration, we don't say very much about actually what is the NHS role and responsibility in supporting change around some of the wider determinants of health. And I think that is something that we should be doing more about in subsequent iterations. Startwell, I think we are saying we're quite ambitious with some of the services that we've described with all of the services that we've described in the Startwell area at the moment, but I recognise that those are quite, they're services that are provided for children with very specific needs, and actually there is more that we could say about how we are supporting sort of general early years development and how we want to work in partnership with local authorities and other partners in the delivery of some of the national and local ambitions that we have around early years development. We sort of put that in as a bit of a placeholder in some of the introduction to the Startwell section, but recognise that there is more that we would probably want to be looking to do as we iterate for subsequent years. Age well, Jason, thank you for clearly demonstrating that you've had a good look through the detailed plans. That's great. Rather than it being light, I think actually age well is one of the areas where we've managed to simplify the message well. And one of the reasons why it's light is because actually, one of the reasons why it appears lighter is because actually quite a lot of the principles about how we support people whose health and needs are more complex, we've already set out in the Live Well section. So we didn't want to duplicate, but recognise that it's more just an intensification of some of the areas of support that we've already set out in the Live Well section. But in that section, we've got some really important stuff about loneliness and connecting people, keeping people active, some of the mental health challenges that people experience. So I think there's quite a lot of richness in that, but we have simplified it down to one particular place. So if I might just try and summarize, I haven't heard anybody sort of disputing that we've got strong alignment between the ambition in the plan and what's in the health and wellbeing strategy. and I've heard a kind of a really positive ambition to continue to work in partnership as we develop subsequent iterations of this for other years. And for that partnership particularly to be at place level, and to really sort of lean into how we are developing and thinking about this at place. And that's really great news, because in subsequent iterations of this development of this plan, the intention is that there will be a much stronger set of ambitions that we are capturing and sharing, that will be coming from places up to the system. And so the will in subsequent iterations of joint forward plan in future years, my expectation is that the sort of place plans and the place voice will be much louder than it is in this first iteration. So that's great. So thank you everybody for comments and feedback.
Thank you, Robert. Jason?
Can I just be really clear? I didn't mean to insinuate at all that age well was light. In fact, I think it's very good, clear and concise. But I'm surprised, I suppose, that others have not tried to criticise on those grounds. I think it's entirely appropriate for that kind of challenge. My concern was more so that actually I think start well possibly needs a bit more detail, because I think that's where there is greater complexity that does not always overlap so well with live well.
Agree. Yeah, thank you.
Okay, thank you. Did anybody else have any questions while Robert's here? Any points to raise? No, I can't see any. Oh, sorry, Andy Tchetsky.
Yes,
Hi,
thank you, Councillor McEwen. I thought just I'd come in as the Vice Chair of the Health and Wellbeing Board. I have not been ignoring you by being off camera. I was just following the rules. Thank you, Robert. Yeah, just my reflection is I think it's a good attempt at trying to get the alignment with the health wellbeing strategy. I think a lot of effort went in by the public health teams and the health and wellbeing boards about in developing the health wellbeing strategy and the joint strategy between the three health wellbeing boards in Berkshire West. I still feel quite passionate that's what we should be doing and working towards for our communities over the next 10 years as the health wellbeing strategy was written for. It's helpful that any health strategy tries to align to that. I think it's got the health and wellbeing strategy had a lot of input from the public as to what their wishes were and what we should be trying to work to support. So anything that health does to align with that, I think it should hopefully align with what our public is asking for. And the stronger that tie-in is, the more credibility this health strategy will have to align with what the public is requesting. Thank you.
thanks, Andy. Thank you, Andy. Robert, did you want to respond?
So Andy, thank you for that, and that's a helpful reminder to me to say that both the development of the integrated care strategy on behalf of the sort of wider BOBS system and all of the partners in the wider BOBS system and the NHS joint forward plan, those are supposed to be working cohesively with existing local strategies. So there is, just to be absolutely explicit, there's no desire for this to sort of overtake or sort of overrule any local strategies. This is absolutely supposed to be working together in a complementary way with what that local ambition is, where there's local understanding, where, as you say, that local voice has been heard and taken into account. So thank you for noting that.
Thank you, Robert. Thank you, Andy. Do we have any other anybody else to speak? No, I can't see anybody. So I think we're required to provide a comment on the joint forward plan, and that will be provided with working with John and Martin, I understand, on behalf of the Health and Wellbeing Board. So that's the next step. So is there any other? No, there's no other agenda items. Rob, but you want to speak?
Yeah, sorry, I'm happy to respond to Rob or Robert. It's fine, don't worry.
Sorry.
I was just going to say about timings. So we are aiming to
wasn't sure about that.
publish the joint forward plan at the end of June. So
Okay.
what we're trying to do is to make sure that we've got the opinion that's been received from each of the health and wellbeing boards before then, so that we can include that in the published version.
So that is right. Okay, at the end of June. Okay.
Yeah.
I know we're catching up next week anyway, aren't we, John? Alice.
Hi, Rob. Thank you, Chair. Just an ask, when you're published, please make it as easy read as possible, please. That's a request. And also, you know, like what Rachel has said, and to make it as diverse as possible with different languages. Because one of the things that had happened during the survey was the fact that it wasn't in different languages, or it wasn't easy read, so people couldn't comment. You know, so I do think if we are planning to engage with the public, let's make it, you know, make it easier for them, because we do very much use language that they are not aware of.
Thanks, Alice. That's a really important point there. Thank you.
Yes. Alice, thank you. When we publish on the 30th of June, we probably won't have the easy read version completed by then, but that is absolutely something that we are working on, and we will have published. We will publish in due course. The different languages, yes, absolutely, we'll continue to take that into account in the way that people can access that. So thank you.
I see Jason.
Sorry, I feel like I'm detaining us longer. So just to clarify from Rob, I mean, what sort of formats are we talking about here? Because obviously the full plan, you're not going to be able to render in an easy read version, I wouldn't have thought. So is it more a kind of summary document that you're talking about?
So we are, yeah, so good question. We're going to start with the summary version. And I've been told that even simplifying that down to an easy read is going to be a challenge. So there is something about extracting the critical messages from that summary version and setting that out in an easy read format. But part of the reason why we're not going to have it ready for June is because actually trying to sort of translate down the breadth and detail that we've got to something that is going to be fit into that easy read format is actually quite challenging to do well. So we're making sure that we put the time and effort into doing that properly.
Yeah, I can see why. I mean, I like the JFP on a page, for example, but it's insufficient in terms of detail. So I get why this is going to be quite, and understand why it might take a bit more time to do all of that.
Yeah. Okay. Right. Thank you very much, everybody. Do we, in case I've missed anybody, is there anybody else that wanted to raise anything or discuss anything I've missed?
Just well done, basically, Rob, within the parameters.
Team effort, but thank you. Lots of people have been involved in it.
Yeah, and thanks for your time today. So
problem.
the next stage is for the response to be sort of prepared.
Right.
Yeah. Well, thank you
Chair,
very
shall I-
much. Sorry,
If I minute that, just in terms of procedure, if I minute that the Director of Public Health liaise with prepare a formal response in consultation with the Chair. I presume that will be an appropriate minute based on the comments that have been made today, sort of thing.
Thank you, Nikki. You took the words right out of my mouth there. That's perfect. Thank you.
Excellent.
And you will chase us.
Well, yes, we've only got till next Friday. We've only got a week,
Yeah.
so.
But we're meeting on Monday, aren't we, John? So we can.
We are,
yeah.
Ruth. Yes.
Yeah. Okay. Smashing. Well, thank you very much for your time today, everybody. It's been really helpful to listen to everybody's comments as well. And enjoy the rest of your afternoons. Take care.
Thanks very much,
Yeah,
everybody.
thanks,
Thanks, everyone.
Bye.
Bye.